Well, part of what's driving that phenomenon is that it's difficult for particularly solo practitioners or those physicians, primary care physicians in particular in small practices, to survive with all of the requirements, all the regulations, all the challenges that those practices face. So here in Cincinnati and, as you said, elsewhere around the country, physicians are looking to health systems to assist them. And one clear example of that, and it is an element of health reform, is that the electronic medical record in physician offices is going to be a requirement under health reform if those physicians are going to be eligible for some additional reimbursement for Medicare. So there's a carrot for these physician practices and also a stick, as their reimbursement will decline beginning in 2014 if those practices don't achieve the definition of meaningful use. One example of some of these challenges facing small practices who can't afford the expense of an electronic medical record. You know, the fact of the matter is accountable health organizations, which I'm sure we're going to get to as part of our conversation today, which looks for health systems working closely with physicians and other providers to create a more seamless system of care for patients, requires hospitals and physicians to work closely together for sure, and the highest form of that alignment is through an employment model. Technology was also mentioned earlier, the importance of that technology, and Mercy Health Partners and actually other systems in Cincinnati are now acquiring a state-of-the-art system called EPIC, which is a clinical information system that has application for the inpatient hospital as well as meets the needs of the electronic medical record in physician offices. That information technology is the glue that's going to tie all of this together. It's going to give us the kind of informatics that Tom referred to earlier for public reporting, but more important than that, it's going to share information about the patient, one record. That seamless healthcare delivery can be achieved through the implementation of this of EPIC. And one last point, we talked about access. Dr. Graham mentioned open access. One of the elements of EPIC is called MyChart, which allows patients access to their medical record, allows them to be connected electronically to their physician's office, allows them to ask questions of their physician, their provider, receive back test results from a recent visit to the doctor's office. Now, putting more usable information into the hands of the patient, the consumer, I think is going to be an important element of this new healthcare system that's being developed right before our eyes.
I want to come back. Tom, you were going to make a comment about that.
I think one of the big catalysts that's going to help us accelerate the transformation here that's occurring in this region is the fact that a lot of physicians are now aligning with one of the big hospital systems. And every doctor I've ever talked with, they didn't go to college to be an IT professional or to be a business professional or to negotiate managed care rates. They got in practice to treat patients. And as we liberate those doctors to do what they've been trained to do and what they love to do and let other professionals do that other kind of work, that's what's allowing it. And I think one of the special aspects of Cincinnati is that there are all these major systems, there are all nonprofit, they all have a fundamental core mission of improving life and improving quality for life for the people in the region. You don't see a focus on profit, you see a focus on care. And as a result of that, there's truly a co-opetition that goes on in this region across all the systems. And I don't see them fighting with one another. What I see them is sitting around the same table saying, how do we improve? And it's unique. It's very unique among anybody who comes to Cincinnati from other cities. That's one of the first things that they remark about.
Co-opetition, is that like repudiate? Let me stay with you on a couple of things you mentioned that also tie into what Tom was talking about. I know that you've been very focused on payment reform, changing the way that doctors and hospitals are reimbursed, because you said that unless we have meaningful payment reform, a lot of the stuff we've just been talking about can't happen. Now, tell me what is wrong with the current fee-for-service system, and what kind of model would you like to see us move to?
Yeah, I mean, healthcare is like a water balloon. You squeeze it in one place, it pops out in another. And you really got to attack it on a system-wide basis. And the problem with fee-for-service is it rewards volume. It rewards activity, whether that activity is the right activity. It also rewards disaggregation as opposed to aggregation. And
define that for us.
You know, all the disparate pieces not necessarily coming together and connecting.
Everything in silos.
As opposed to working as teams and in a very integrated fashion. What we need to do is move to a payment system that rewards value and outcomes. And the hard part is it's very difficult to transform a single piece of the payment system. You know, the government pays for half of all health care, employers pay for a piece, individual, small business, many of the people in this room are all paying for a good chunk of their own health care. And it's very hard to move the whole ship over. So I really applaud that there are these pilot programs going on to help pay for some of the patient-centered medical home, to help pay for some of the new approaches. But it is a challenge, and many of the big employers don't like to change it in one city or with one small group of practices. So it is a big issue.
I want to shift gears a little bit because we've talked a lot about hospitals and doctors, appropriately so. But I think we also need to make sure we're coming back to the consumer, who I think is one of the prime focuses of Maria and her organization. And I'm going to ask Maria a question, which I also want to ask Bob as the physician representative on the panel. You didn't know that you're representing all physicians today, did you?
Neither did they.
Neither did they. Okay. And this may sound like a very simplistic question, but I don't think it is. Maria, how do you define healthy? Is there something more to it than just the absence of disease? And what does that mean to a consumer?
Yeah, that's a... how long did you say we're going to be here? And that's a deep question. Healthy is an evolving state. It's a state of being that allows you to not be hindered. And so not be hindered could be disease, could be mental state, could be ability to expand your life, not limited by some of those chronic diseases. And it's an evolving status because your challenges at different stages of your life are different. And how do you remain healthy? The typical consumer doesn't give that much thought. We just take it for granted. We've not, as consumers of healthcare, been necessarily empowered to be healthy. You see a lot of talk about, for instance, the food pyramid. That's been around forever. How many people, can rattle that off and know what it means? When we make choices in our life, do we really think of the state of our health as part of that choice? And we don't typically do that. We take it, quote unquote, for granted. Part of that is because when we're young, we tend to be, quote unquote, healthy. Nothing holds us back. Nothing keeps us from doing the things we want to do. But yet it's in those years where we're laying the foundation for the future state of health. So childhood obesity is an example, is a problem not just when it's early in a child, but for the repercussions it will have later on. And in my mind, the sense of what is healthy and what am I doing about it should become part of the individual healthcare consumer's responsibility. So how do I stay healthy? How do I ensure that I'm doing today what's right for me today and tomorrow? I had an interesting conversation with a pharmacist who happens to also run a holistic medicine office. And in her pharmacist role, she's looking for taking care of all of that quality and assurance within a hospital system around pharmacy and pharmacy dispensing. In her holistic medicine practice, she's actually trying to get people off the meds. And so it's a very interesting dichotomy, but it talks to that individual care for health. Why am I on these meds? What alternatives are there? Because like everything we do in life, there's a price to be paid for any med that you put into your body. So that awareness, that healthy awareness is what I think as healthcare consumers we are going to see as we evolve into more of the medical home and the patient as an active collaborator with their physician in managing the outcome of their care.
Bob, I want to ask you the same question, how you would define healthy, but I also want to ask you, does that word really have meaning for a physician? Medicine has always been built on the sickness model. In other words, you come to the doctor, you come to the hospital when you are ill, when you have problems. Like I said, I want to find out what your definition of healthy is, and I want to find out what level of meaning that has for physicians and hospitals and healthcare providers who really have been trained up in a sickness-based philosophy.
All right, and before I answer that, I'm going to use one of my Washington lessons, and that is answer the question I want to answer before I answer yours.
That's not on my list.
I want to go back to something that Tom Urban said and that you echoed. Healthcare is a growth industry. Wrong verb tense. I think healthcare was a growth industry. 17% of GDP goes to healthcare right now. How many of you want it to go to 20? I don't see any hands. That's what it's got to be if it's still a growth industry. You know, we've gone from 13 to 14 to 16 over the last 10 to 15 years. And the way we've done it is because employers have put more and more money into benefits, and because the government has put more and more money into Medicare. And everything that we're hearing right now is we're not going to do that anymore. GE has gone, for their Evandale plant, has gone from a defined benefit plan to a high deductible plan to control costs. This Congress will start wrestling with Medicare as a major threat to the fiscal solvency of the country for the next 20 years. Tom's described his ideal hospital, which is half full and no waiting time in the emergency room. That's better for health care. It's better for health status. It's going to take a different model, but it's no longer a growth industry. I think we're as likely to be at 15% of GDP in 20 years as we are 20%. And so, because this is a Chamber of Commerce meeting and you guys are thinking in terms of a business sense, is what are your business opportunities and what are your business risks as we move from healthcare being growth to healthcare being cost containment? Now I'll try to answer your question.
Finally.
Does it take us 2 minutes already?
I think you've described the medical model that most of us are trained in. It's a reactive model. It's also something, there's a lot of cultural differences, and those of you that have lived in other countries, have worked with other healthcare systems, the United States system is very much based on Western medicine, but more than most places, it's broke, doctor, you'll fix it. And I don't want to mess with it until it's broken. And so why do we have so little attention to prevention in the United States? It's not just because the medical profession is kind of focused on, take care of it and do things and, use instruments and get paid for it. It's also because the patient population that the physicians deal with, by and large, have low degree of motivation. As Maria said, you're 25 years old. What are you thinking about you want to be at 40 and 50? How many people in the room know what their body mass index is? Under 25, you're probably eating well and exercising well. Between 25 and 30, you're at risk for developing some types of chronic diseases. Over 30, you are a risk for your health. How many of us know where we are? So I think, the American medical approach to healthcare is pretty much rooted in our culture, which is a short-term, I don't want to think about it long-term, please doctor fix it, and the patients and the physicians sort of reinforce each other that way.
Tom.
We study consumer attitudes toward health quite a bit at Proctor, as you could probably expect, and it's one of the key parts of my business. And what I will say is, I agree with everything Bob said, but we're seeing a shift. The World War II generation and older pretty much was completely sick care. The boomers have a different attitude. As they have started to age, they are fighting aging.